in my entire medical career, spanning for more than 20 years now, I have always heard two specific questions from a patient parties after any sort of operation. Number one, immediately after the operation is over, Dr. Babu, patient kokhon khete parbe? When my patient is going to eat? And number two, Dr. Babu, Horlicks khabe to? Whether my patient can eat Horlicks or not. I am spellbound always, and I am astonished by these two specific questions. Irrespective of caste, creed, class, whatever you say, in big hospitals, in small nursing homes, in government institutions, everywhere I get these two specific questions. Everywhere, every time. I am confused. What to say? Hello friends. This is Dr. Arghya Basu, gastro and cancer surgeon, welcoming you all to a very interesting episode of your own YouTube channel Arghya, where we discuss various gastro, cancer and surgery related problems and try to help our patients and viewers with accurate and state-of-the-art medical guidance, even at personal level. Hello friends, I am Dr. Arghya Basu, gastro and cancer surgeon, welcoming you all to your own YouTube channel, where today we are going to discuss about what to eat and what not to eat after any surgery or any cancer therapy. So, at the beginning, I will first prescribe that even if you are having a major surgery or you are undergoing treatment for cancer, always get a diet chart from a trained nutritionist or a trained dietitian. Don't try to formulate your own diet chart. That can be disastrous. So, on the basic aspect, what are the 6 ingredients of our diet? There are 6 ingredients: carbohydrate, protein, fat, vitamins, minerals, and lastly, water. So, there should be basically no scarcity of water to be taken. You should take ample amount of water to keep your body rehydrated. And that almost all of us by now know that more than 70% of our body is made up of water only. So, water constitutes the most important matrix of our body. All our body cells and tissues are suspended in water. So, there should be no constraint in water intake unless and until you are having some heart disease, some kidney disease or some other medical causes which are prohibiting you from taking excess amount of water. This water amount to be consumed daily for a person is actually decided on a very complicated formula by dietitians, but we can tell you that every day a person urinates about 1.5 to 2 liters, and all other type of fluid losses from our body like sweats, with stool, by perspiration, by respiration is around another 1 and 1.5 liter. So, your water intake should be at least 3 to 4 liters per day approximately. This is an approximate amount that you should take, but the exact amount varies according to the height, weight, caste, race and geographical areas. I am just giving you a broad margin just to give you an idea. When I am telling that you should take 3 to 4 liters of water per day, please don't take 6 liters of water per day. It will put unnecessary burden on your body. But please don't take 1 to 1.5 liter also, because then your body will be underhydrated. That will be leading to disastrous consequences in short term as well as long terms. Often we have seen that people develop kidney stones because of taking less amount of water is actually one of the causes of forming renal stones and getting renal stones lodged in different parts of our urinary tract. Now this is all about water. Let's come to other parts. The most important part of our diet is carbohydrate. We are all Bengalis. Most of my viewers are Bengalis. So everyone knows कि Bengali को मीठा के सिवा कुछ चलता नहीं है. We are very fond of rasgullas and our mithais which all of which are our age-old tradition. This is a part of Bengali culture, and all over India, Bengalis are very sweet people, and everyone knows that Bengalis have affinity for sweet things. But cut the carb. Carbohydrates are the primary source of energy in our body, in Indian context as well as Western context also. But whenever you take excess amount of carbohydrate, these carbohydrates gets converted to lipids or fats, which gets accumulated in different parts of our body, which gives you a good tummy, which gives you a well fatty liver, and which gives you accumulation of fats inside all your blood vessels and hearts, which ultimately gives you a heart attack. So cut the carb, reduce the amount of carbohydrate. Always take the amount of carbohydrate that your dietitian or your nutritionist has prescribed for you. Don't take much of carbohydrate. It is ultimately disastrous in long term. You have to take every ingredient in prescribed quantities. Everything is hazardous when it is taken in less or more quantities. All of these ingredients have prescribed amount. Take your diet according to those prescriptions. Now, I have seen many people who are taking tea. They are pre-diabetic or they are fearful of getting diabetic. Now they are taking what kind of tea? They are taking milk tea but without sugar. Then what is the point? They are thinking that they are avoiding sugar so that they won't be getting in diabetic range. But the milk they are taking in that tea itself is a huge source of carbohydrates in our body. So there is no point. If you want to check your carbs, take the tea without any milk, without any sugar. Or if you are not diabetic, you are not in pre-diabetic range, enjoy your full cup of tea. There is no point in restricting carbohydrate. Don't think that restricting sugar or restricting milk in your morning tea or evening tea will prevent you from getting into diabetic range. In type 2 diabetes, proper diet, control over carbohydrates is an essential part of treatment. But don't think that if you lead a monk's life, you won't be having diabetes. I have seen lots of people who eat a meager meal per day, but they are very high diabetics. So diabetes is genetically controlled. If you take your normal meal or you keep yourself under fasting regularly, you will get that diabetes. You cannot prevent it from happening. But what you can do, you can control your diet so that your sugar level is under control and you live for a longer lifespan. That you can do. Now next, let's come to the next ingredient, which is lipid. Lipid is essential. Lipid or fats are one of the most essential parts of our diet because they are the richest form of energy. 1 gram of fat contains maximum amount of energy, and it is much more than the carbohydrate or protein counterparts. Vitamin, mineral and water doesn't have any energy content. The energy is always concentrated in carbohydrate, lipid and proteins. Now, basic amount of lipid is required in the body, but excess of lipid can be disastrous. Excess lipids, there are different kinds of lipids in our body like HDL, LDL, VLDL. All of you have actually heard of these names. HDL means high density lipids, high density cholesterols, which are actually protective in nature. Hilsa fish oil is one such thing which has redundant amount of HDL and it can protect your heart from getting a heart attack. These are good cholesterols. On the other hand, LDL, low density lipoproteins, VLDL, very low density lipoproteins, these are extremely harmful to our body. So whenever you continue taking excess amount of lipid is ultimately the storage form of energy in our body. Whatever excess calorie we take, that gets concentrated and accumulated in different parts of our body as lipids. So restrict your lipids. Otherwise, these lipids will get accumulated inside your blood vessels, inside your hearts, inside the blood vessels in your brain. So carbohydrates and lipids are the two most dangerous entities that we have in our diet. Whenever you are taking excess carbohydrate, it is getting accumulated as lipids, and these lipids are accumulated in all blood vessels, which ultimately causes what? It blocks all the small and medium blood vessels to the entire part of the body. That leads to brain stroke, that leads to a heart attack, that leads to kidney failure, that leads to a small stroke, what we call in our eyes, leading to damage to our retina, so that a person can have immediate loss of vision. So sugar, what we conventionally call diabetes, is known as sugar. So diabetes is such a disease that whenever your blood sugar level is under control, yet the disease is doing away with your body in its own way. The diabetic patients who have their sugar levels under control, the cholesterol levels under control, till these people suffer from heart attack, suffer from brain stroke, suffer from ophthalmic stroke, suffer from kidney failure, and so on and so forth. The list is endless. So what is the take home message is that you might ask me, sir, if this happens, what is the point in controlling diabetes? Or what is the point in taking anti-cholesterol, anti-atherogenic drugs? The thing is, if you have a control over your diet, if you keep your sugar levels under control, if you keep your cholesterol levels under control, you will face these disastrous consequences after 30 to 40 years. Whereas if you won't take these medicines, you will have them in coming 5 to 10 years. So these drugs, these exercises, these diets, they actually help us to put a brake on the disease process. That gives you extra mileage over your lifetime. Now the third most important ingredient is proteins. Proteins, you know, nowadays all of our younger generations, teens and 20s and early 30s, everyone hits the gym after seeing Hrithik Roshan, after seeing Ranveer Kapoor, after seeing Ranveer Singh, and the girls as well. After seeing Aishwarya Rai Bachchan, after seeing Deepika Padukone, after seeing there are n number of actors and actresses who has actually motivated our younger generation to stay fit and to keep in shape. But the bad part in it is, previously our bodybuilders, our wrestlers used to build their bodies by taking natural food, by taking natural ingredients, by doing more of workouts. But nowadays in gymnasiums, people are in a hurry to get in the shape of Hrithik Roshan or Ranveer Singh in no time. So they will give only 3 months of time and 3 lakhs of rupees to a physical fitness trainer just to make them from a Tamiwala bong to Hrithik Roshan. That is disastrous. This thing kills people. Whatever steroids they are taking, whatever extra protein ingredients they are taking, they are doing away with their kidneys. They are doing away with their bodies. So please, please and please avoid these artificial bodybuilding substances as much as you can. Whatever natural is there will stay with you for the entire life. And if you try to become Hrithik Roshan by taking extra protein shakes with disastrous or hazardous chemicals, that will ultimately shut your kidney down in a few years, in simple words. So be aware. You should take around 40 to 45 grams of proteins per kg of your body weight every day. That may be in the form of fish, chicken, mutton, animal proteins, as well as plant proteins. Now plant proteins lack a few essential amino acids, whereas animal proteins, they are not only chicken, mutton or animal proteins, animal flesh, but milk is also another kind of animal protein which gives you adequate amount of essential amino acids. So we Bengalis are pure non-vegetarians, so we never suffer from protein deficiency in our lifetime unless we have stopped eating because of geriatric complications. Otherwise, Bengalis do not suffer from protein deficiency. But on the other hand, who are pure vegetarians often suffer from deficiency of a few essential amino acids, which they can supplement by taking milk and milk products, which are actually source of animal proteins. So you should take adequate amount of protein. In our surgical and cancer patients also, we always prescribe some protein powders, but they are medicated protein powders. They are not bodybuilding protein shakes. They have multiple ingredients mixed in proper appropriate amounts and ratios so that to give the patient a balanced diet. And if you are diabetic, then please take the counterpart of these protein shakes which are made for diabetic people, not the normal protein shakes. You should keep your body toned, do some regular exercise in the form of cardio, restrict your binge eating or overeating pattern. Please avoid fast food and oily foods as much as possible. I am not telling you to live a monk's life, but live a normal life. But the definition of normalcy will vary from person to person. So my point is, visit a trained nutritionist or a trained dietitian who will give you a balanced diet chart so that your body can thrive well. You can take the stress of a surgery, you can take the stress of cancer treatment like chemotherapy, like radiotherapy, and so that you can live a perfectly happy, healthy life together. Please listen to the video till the very end so that you don't miss any vital point, and at last where I will share with you the links how you can get in touch with me and get personalized advice and guidance. Now we will go to the treatment and further discussions part, but before that, if you are enjoying the show and अगर आपको कोई benefit मिल रहा है तो please ये चैनल को सब्सक्राइब कर लीजिए एंड बेल आइकॉन को प्रेस कर दीजिए so that you will get notification every time we post a video, and this will give me and my team a huge inspiration for our hard work. Thank you. Now without any further delay, let's dive deep into the problem and how we are going to tackle it. Now let's come to the second part of our this healthy chit chat on dietetics. The two ingredients that are remaining are minerals and vitamins. Now you know that all kind of minerals and vitamins are not only necessary but also essential to keep our body growing and thriving. Mostly cancer patients suffer from anorexia. What is the meaning of anorexia? That means loss of appetite. Cancer patients suffer from loss of appetite because of the effect of cancer itself, because of the effect of the chemotherapy drugs, which are actually toxins which kills the appetite, and there are some anorexia causing chemicals in our body which causes cachexia. Cachexia is the term which means whenever a patient loses lean body mass, the patient loses a balanced body weight and becomes lean and thin. It is called cachectic. The patient becomes cachectic. Now, if a patient is not taking her food properly, how he can fight with the cancer? Cancer is such a disease that kills the immunity of the system. Now, if you do not give vitamins and minerals in adequate amounts so that your immune system is strong and has the potential or ability to fight the deadly disease like cancer and superadded infections to cancers, how you are going to thrive? So in almost all the cases, we give supplements for minerals and vitamins to our cancer patients. I personally give these supplements to my surgical patients also other than cancer, and all other geriatric patients who are already suffering from immunodeficiency. and I have often seen that supplementing patients with microminerals for short term in surgical patient other than cancer, and for long term in cancer patients who need therapy for long term, enhances the result of the treatment protocol tremendously. That gives out a markedly marvelous result to our patients and patient parties. The most common problem after every surgery, whatever the patients and their parties complain to us, is that in the immediate post-op period, when we are giving some antibiotics, some painkillers, some other kind of medicines to the patient after surgery or after chemotherapy, it actually destroys the normal microbial flora of our stomach. That leads to gastritis, that leads to lack of vitamins, that leads to lack of appetite, lack of sleep, and the patient becomes very lean and thin and weak. Supplementing them with prebiotics and probiotics and vitamins and minerals tremendously enhances the outcome of the surgery. What are prebiotic and probiotics? Actually, prebiotics and probiotics are such microbes which form vitamins inside your stomach. We can supplement the patients in the form of prebiotic probiotic capsules, sachets, tablets, or there are some health drinks available also which have fresh prebiotics and probiotics. Giving these prebiotics and probiotics in the post-operative, post-chemotherapy, or during entire cancer treatment tremendously enhances the outcome of any surgical patient or any cancer patient. But whatever you do, always do it under professional guidance. Every time I say that there is a marked difference when a thing is done by an amateur and a professional. Often people ask me in the post-operative period or in my OPD consultation, sir, you just give us a diet chart, we will try to follow that. No, this is not the way. You should take the diet chart from a trained dietitian, from a trained nutritionist, and try to follow that in toto. If not possible in 100% accuracy, try to follow as much as possible so that you can give things at appropriate amount, at appropriate quantities, at appropriate ratios. These people have been trained with this subject for so many years. They have put in their efforts so that they can feed you in a healthy way. Therefore, I always suggest, always visit a trained nutritionist or a dietitian before you start any kind of surgical therapy or any kind of cancer therapy, or even if you need nutritional management for chronic diseases. And therefore, this specific video is dedicated to all the nutritionists and dietitians who are working with me and for the benefit of our patients throughout the world. Thank you. You can get connected with me and follow my posts, videos and blogs in my social handles given in the description box just below. If you want a personal consultation with me, please WhatsApp or call in the following numbers. My team members will personally get in touch with you as soon as possible.